Hello. It is well known that breastfeeding is the best option for you and your baby, but we know that breastfeeding can also be challenging, especially for first-time parents. In this video, we will explain the benefits of breastfeeding and give you some useful tips to help make your breastfeeding experience successful. There are many benefits of breastfeeding for your baby. It protects them from infections as your breast milk contains germ-killing proteins that fight against tummy bugs, colds, and chest infections. Breast milk is full of vitamins and nutrients which will help your baby grow. Breast milk lowers the risk of some medical conditions, including sudden infant death syndrome, childhood leukemia, diabetes, and obesity. And it reduces the risk of your baby developing allergies. Breastfeeding is also good for your health as it reduces your risk of breast and ovarian cancer, weak bones, diabetes, and heart disease. Breastfeeding also helps your uterus or womb to shrink back down to size and helps you lose your baby weight. Breastfeeding can burn around 300 calories a day. We also know that breastfeeding helps you to create a bond with your baby, which is beneficial for your mental health and your baby's development. On a more practical point, breastfeeding also means that you have a constant supply of food for your baby that is at the perfect temperature. Your baby will let you know when he or she wants to feed by becoming restless, sucking his or her finger, or making mouthing movements. Offering a feed before he or she becomes upset and starts crying will make feeding easier for you both. You can also offer your baby your breast when they want a cuddle, if you need to fit in a quick feed, or if you simply want to sit down and have a rest. Before attempting to breastfeed, make sure you are hydrated and find yourself a quiet place where you can feel relaxed. There isn't one certain position that is correct for breastfeeding, but rather it is important that you take time to figure out what feels best for you and your baby. You may want to use a pillow or cushion to support your baby whilst they feed, but make sure they can move their head freely. Use the chin reminder to help you position your baby. C for close, H for head free, I for in line, N for nose to nipple. Here are some signs that your baby is feeding well. Your baby has a large mouthful of breast and their chin is firmly touching your breast. It doesn't hurt you when your baby feeds. Your baby rhythmically takes long sucks and swallows. Your baby finishes the feed and comes off the breast on their own. It is also possible to express milk yourself. This can be useful to tempt your baby into a breastfeed and to relieve your breasts if they are too full or if you run into a problem such as a blocked duct. You need a sterile container to hold under your nipple. With the other hand, cup your breast and use your thumb and fingers in a C shape to gently squeeze and then release the area around the nipple. Repeatedly do this until milk starts to drip and then flow. Do this in a couple of positions on one breast before moving to the other. If you have any questions or concerns about breastfeeding, speak to your midwife or the health visitor. There are breastfeeding support groups available where you can speak to others about their experiences.